When sex therapy was introduced in the 70s, much of the focus was on intercourse and sexual functioning, which centered arousal and orgasmic concerns. It was thought that sexual satisfaction hinged on penetrative sex and being able to climax, and especially being able to climax from penetrative sex. Therefore, we have diagnoses around ejaculation and erectile dissatisfaction, absence of and changes in desire and arousal, and pelvic pain and penetration disorder. Keeping in mind, though, that to meet criteria for these, there must be some level of distress for the individual. But because we tend to prioritize physical and physiological arousal responses, such as the presence of an erection and increased vaginal lubrication, hence intercourse, many people experience so much embarrassment and frustration whenever sex does not look that way. This not only places sex in a box of heteronormativity, but also in ableism. So, we are taught what we should find sexually arousing and what behaviors sex should include, which then influences our desire landscape. So let's dive into definitions of desire. The definition of desire that I use with clients is simple. It is to want. I like this definition because it creates space to talk about the variety of experiences that people want before wanting sex feels like an option. They want connection, emotional vulnerability, playfulness, and rest, which can then open the door to wanting sex. Likewise, they may want aggression, domination, spanking, and dirty talk as part of their sexual experience. If you are familiar with Esther Perel's work, she describes desire as the owning of the wanting. She says that wanting is an essential piece of our sovereignty and that there needs to be a deserving I that feels able and even entitled to engage with that part of ourselves. And that when we lose desire, we lose a vital connection with ourselves. I love this concept because it explains the reason why we cannot simply tell someone to just do it when they are struggling with sex in their relationship. They have to own the wanting, and our goal as therapists is to help them reconnect to that wanting in a way that is authentic and valuable to them. I came across the work of Om Swamiji, a spiritual leader and author, who described desire as a thought that you haven't been able to abandon. It's that game of Candy Crush you're trying to play, not so much. The strawberry pancake you're craving. The TV series you plan to binge, the move you want to make on your partner. Once you let this thought go, you are no longer experiencing desire, the wanting, or the longing, at least not in that moment. But when you don't get the thing you desire, emotions are evoked, such as disappointment, tension, internal conflict, and frustration. And so we can see desires of all types indeed making the world move. And if desire is about owning the wanting and a thought that you haven't been able to abandon, what I see most common in my therapy office is the challenging pursuit of desire in which partners begin to feel unseen or ignored, less than, wrong, and inadequate. A desire standoff that begs for emotional and sensual warm-ups that prove sexual desire is actually worth conjuring. So I invite you to take a moment to consider not only your definition of desire, but its presentation. How does it show up in your own life? Then think about how your clients describe it. Now let's define desire discrepancy. Most commonly, you'll see it defined as a sexual dynamic in which one partner desires more sex than their partner desires. Another definition is the difference between one's desired frequency of sexual intercourse and the actual frequency of sexual intercourse within a relationship. With either definition, there is a discrepancy to unpack and explore. I like to talk about something I've dubbed the desire seesaw, in which I describe the imagery of a seesaw where the person who has the higher level of desire is in the air and the one with the lower desire is on the ground. I like this imagery because it clarifies that the goal is not to have both people in the air or on the ground, because with the seesaw, that actually is not possible. The way that a seesaw works will never allow for both sides to be at the same height at the same time. Instead, what I am working on is getting them to a more balanced position and closer together. That way, they aren't simply balanced and at opposing ends, but are positioned near the center, representing increased connection. But what I noticed the most is that on this seesaw, the partner with higher desire wants their partner with lower desire to meet them up in the air. And sometimes the lower desire partner starts to put on as much weight consciously or subconsciously on their end because they've become anxious or resentful about moving from their own position. And there might be several desire seesaws in one relationship. I like to bring this up because couples often get sort of stuck on their sexual desire discrepancy, so I remind them that sex is likely not the only area they experience a desire difference. Why is it that we understand that we might not want to eat the same thing at the same time, or want to go to sleep and wake up at the same time, to travel the same amount or at all, to go to musical festivals and concerts, to do puzzles and scroll social media? I mean, it's endless. But we tend to work it out without so much shame and stress. But when it comes to sex, something is different. And I've grown to be very curious about this difference. The difference lies in the fact that when our partner does not want to have sex with us, we take it personally. We say that sex is part of affirming our attractiveness and desirability. We say it is how we connect emotionally, and without it, we began to believe some very untrue things about ourselves and our relationship. But the kicker is that some people might experience the same turmoil when their partner doesn't want to eat with them or travel or go to a concert. Somewhere, somehow, likely considering their attachment history, they've learned to interpret this difference as a rejection. And we'll dive more into that a bit later.